Hello, I'm Mehnaz Mahmood. Today I'm going to give presentation on sugar reduction policy in management of diabetes in Scotland. First, what is diabetes? Diabetes is a chronic metabolic disorder that occurs either due to insulin deficiency as the beta cells of the pancreas cannot produce enough insulin or due to peripheral tissue resistance, decreased sensitivity to the action of insulin. Types: Type 1 diabetes mellitus, where insulin is not produced enough to control blood glucose level. Type 2 diabetes mellitus, where insulin resistance occurs and produced insulin cannot work enough to control excess blood glucose level. Gestational diabetes, the diabetes that occurs during pregnancy period, and others. Others can be occur if the person has genetic factors or have any drug effect, or maturity onset diabetes of the youth. Now, the prevalence. 1 in 20 people is diabetic, and at the end of 2013, about 268,154 people were diagnosed with diabetes, recorded in the local diabetes registers in Scotland. Across NHS boards, crude prevalence of diabetes is ranged from 4.34% to 5.8%. The Scottish Public Health Observatory, that is ScotPHO, has estimated that about 49,000 people have undiagnosed type 2 diabetes, and Diabetes UK has estimated that 620,000 people are at high risk of developing type 2 diabetes in Scotland. According to ScotPHO, increase in type 2 diabetes mellitus is due to poor diet. Poor diet means like excess calorie intake or sugar containing food, that means junk food, energy drinks, and living a sedentary lifestyle like less physical activity, and which is causing them over gaining weight and resulting in obesity. Then the dietary habit, Scottish diet remains high in calories, fat, salt, and sugar, and they are consuming low nutritious food and healthy food such as fish oil, fibers, fruits and vegetables, then whole grains, etc., and are increasing the rate of obesity, and which increases the risk of developing diabetes as well. The major cause of developing diabetes in Scotland is poor eating, which leads to obesity. Due to HFSS food, that is high calories, fat, salt, sugar intake, and inactive lifestyle, the rate of obesity is increasing day by day. And due to the overweight, the metabolism of the body is slowing down and insulin cannot act properly. So managing obesity is an important factor to manage diabetes as well. Now, management of diabetes. People who are 25, more than 25 years should should undergo of screening, who have family history of diabetes and who are obese and already have other health conditions like hypertension, PCOS, etc. On screening, the people who will be diagnosed as diabetic patients should be consulted with physicians for the better treatment, and who will not be diagnosed should be advised to be careful and maintain a healthy and active lifestyle. Scottish Government, through the Scottish Diabetes Group and NHS boards, has published some policies to give better management of diabetes. In 2000, Scottish Executive published a Health Department Letter, that is HDL, for the annual survey of diabetic patients, and in 2002, they issued Scottish Diabetes Framework to improve the quality of service of care for diabetes. Then in 2014, Scottish Government made Diabetes Improvement Plan through the Scottish Diabetes Group and NHS boards to motivate the manufacturer to cut back on sugar in soft drinks. The UK Soft Drinks Industry Levy, that is SDIL, was first announced in March 2016 and then implemented on 5th April 2018. Now, SDIL, the sugar control policy which I am working on. Under this legislation, there has been issued a tax of 24 pence per litre if in a drink with more than 8 gram per 100 ml, and drinks with more than 5 gram but less than 8 gram require a tax of 18 pence per litre. Drinks less than 5 gram do not require any tax. The Scottish Dietary Goal recommends that daily energy intake from sugar should be 5%, but on an average, the adults in Scotland consume more than 14.1% of their daily energy intake from sugar, and in poorer areas, people consume almost 15.1% of energy from sugar daily, which is almost 3 times more than the recommended percentage. As 65% of people in Scotland have become overweight or obese due to a high intake of sugar-containing diet, NHS Health Scotland warmly welcomed this introduction of the sugar tax. According to the public health advisors of NHS Health Scotland, people of Scotland are leading a sedentary lifestyle and becoming obese day by day, which is leading to type 2 diabetes, cardiovascular disease, and several cancers. Fiscal policies like taxation or levies can contribute to motivate the beverage manufacturer to add less sugar in drinks they produce or import, and also the common people who will purchase less, and high price affects less purchase, and less purchase means less consumption. Now, implementation of sugar tax. For maintaining a healthy diet and reducing obesity, the sugar tax is an important first step among all the policies that have been taken to address Scotland's poor unhealthy diet. Researchers studied the volume and amount of sugar-containing drinks in household purchases 2 years before and 1 year after the introduction of fiscal policies, that is sugar taxation or levy, and they saw a significant change when all untaxed and taxed drink purchases were combined. The volume of sugar contained in fizzy drinks purchases was not affected, but there was a reduction of 30 grams of sugar per household per week. It is similar to 3 fewer teaspoons per person per week, a reduction of almost 10%. As a result, sugar consumption is reduced without affecting the number of soft drinks purchased. So, two benefits at the same time. Health is maintained as well as business is not getting affected. Scotland's Food Act established Food Standard Scotland, that is FSS, in 2015 as the public sector food body which works for maintaining the safety and standards of food quality and also ensures that nutritional values and labeling are consistent, consumer focused, and evidence based. Response of FSS to SDIL. For the reduction of diet-related diseases, FSS approved different proposals, and so it welcomed SDIL as an important measurement to take action against sugar-sweetened beverages which are causing obesity and later on diabetes in Scottish people. For improving the food environment and influencing food choices, they considered that taxation on sugar-containing beverages created price differences which shifted the consumer's behavior toward healthy and less sugared foods and drinks. The FSS would appreciate a commitment from the UK government to assess the impact of the levy on health outcomes as quickly as possible, to allow devolved administrations to take into account the potential impact of the measure. It is therefore important to specify success criteria for this measure. They are emphasizing reducing childhood obesity by focusing on ensuring a nutritional diet and restrictions on junk food and healthy and energy drinks for the children. If SDIL failed to fulfill the desired criteria, then FSS would have considered other alternative measures for the dietary management of Scottish people. The role of Scottish government. The Scottish government is urging the UK government to extend the SDIL to include sweetened dairy drinks, including instant powder containing less than 95% milk, to meet the 20% sugar reduction target. The Scottish government is also calling on the UK government to make more use of tax system to make healthy food cheaper and reduce the purchase of food containing high calories, fat, sugar and salt, that is HFSS food, and has given the necessary authority to the Scottish Parliament in this area to ensure enough levers are open to consideration. They also put restrictions on purchasing energy drink for the children below 16 years. Along with UK government agencies, the Scottish government launched a voluntary color-coded nutrition labeling scheme in 2013, allowing consumers to easily identify products easily identify products of HFSS. Now the public response. To be healthy and to get rid of diet-inducing diseases, about 62% people of Scotland supported taxation and on sugar, and about 82% people supported the action of consuming less sugar-contained food and drinks, and they have become more aware and conscious of diabetes and obesity. Thank you.